Since caring for its first patient in 1953, Cone Health has been committed to providing exceptional care to the Greensboro community, capitalizing on a right care, right place, right time model that is promoted from the top all the way down to the front lines of the healthcare network. The goal is to reduce the number of patient visits by adopting a shift in healthcare, moving away from being volume-based to instead being value-based.
We discovered that a particular lady had visited the emergency room a very large number of times during a one-year period. And when we really peeled back the onion to understand what was at work there, it turned out that she lived alone, she was wheelchair-bound, she was diabetic, she did not have a working refrigerator, she had no wheelchair ramp, so the basics were missing, and she was very lonely. And so her default was to call 911. We actually built her a wheelchair ramp, bought her a working refrigerator, got her home visits, and took care of some of her other basic needs, and she has not been back to the emergency room since.
In essence, it takes a village to provide the level of care available through Cone Health, drawing from partnerships with 1,500 physicians who invest in patients from the moment they are admitted to the hospital to the services involved in their recovery after they go home.
So the Triad Healthcare Network is a Cone Health-sponsored accountable care organization. And accountable care organizations have sprung up all over the country, and they have as their primary focus to integrate care across the whole continuum. So that would be from when a person is healthy in the community to when they need outpatient services to when they need inpatient hospitalization and after.
Tonya Moore can attest to Cone Health ranking among the best places for care in the country. She's the first person to undergo a heart assist procedure, opting not to go to Duke, where she said she would have felt like a number because they perform so many of these procedures. In contrast, Tonya feels like her Cone Health medical team is part of the family.
We have the best physicians, I think, that are in the state, but we still have that small hometown feel. You know, especially here, you know, in the heart failure clinic and with the LVAD program, we know them, they know us, they know our kids, they know our pets, so we still get like just amazing care, but they're also part of our family.
Tonya is a medical miracle, admitting she probably wouldn't be alive today had it not been for this technology introduced to her 4 years ago.
My heart was only functioning at like 14 to 17% by the time we put the LVAD in. So I don't think, I honestly do not think I would be sitting here if I didn't have this. I don't think I would have made it another 4 years.
Cone Health prides itself in being #1 when it comes to the reduction of heart attack readmission rates.
It's the coordination with the doctors in the office once the patient is discharged. With our rehab, we have a great cardiopulmonary rehab team that helps the patient continue to get well after discharge. And we have what we call wraparound care. So we have care managers who, if people are recognized as at being particularly high risk, then they're assigned a care manager who will check in on them once they've gone home. And so we're able to provide that level of care. We also have great pharmacists to make certain that people understand their medications. So what medications are you supposed to stay on? What medications should you stop? Because that can all be very confusing to people. And for the folks who have the greatest needs, we even have social workers who can help them. So it's a very much a wraparound kind of care, so that it doesn't just begin and stop when people are in the hospital with their heart attack. It continues after they go home.
This 10-pound device has given Tonya a new lease on life, allowing her to enter a 5K and to witness milestone moments in her children's lives.
My daughter had already graduated high school. She was in college. So, I mean, just having this device, I got to see her graduate from college. I was able to see my son graduate from high school, able to see him graduate from college. Now both of my children are engaged. Now we're in full wedding planning mode.
Cone also leads the nation in experimental technology, being the first to pilot a vest developed by the Department of Defense to detect fluid buildup in the lungs of heart patients. an added convenience to patients and their home health care.
So now we're partnering with our home health care agencies and having a group of patients that are at high risk for readmission wear the vest, transmit the information back to our heart failure doctors daily, and if the fluid starts to increase, then the doctors are adjusting the amount of their diuretic to help them decrease the fluid. And in doing this, we've actually dropped the readmission rate in this group of patients from 23% down to 14%.
Cone Health is one of the largest, most comprehensive integrated health networks in North Carolina, touting 6 hospitals, more than 150 locations, 12,000 employees, and 1,500 doctors, providing a wide range of services in this region.
It's really across a 5-county area to our north, south, east, and west, and even more recently further south through our management services agreement with Randolph Hospital, who we now consider part of the family. So we are very definitely a regional health system.
An example of this regional outreach is Kathleen Linder, who is a knee replacement patient receiving physical therapy in Kernersville, where she lives.
From surgery to rehab, it's been a really good experience. The hospital surgical staff all the way through staff on the floor were fabulous. And then I got to come to rehab here in Kernersville, and that's been a great experience as well.
Cone Health once again leads its competition, being the first to implement Xenex, a high-tech machine used to eliminate infectious bacteria.
So we were the first hospital in the state to use ultraviolet light technology. We use a machine called Xenex to clean in our hospital. So the Xenex has been shown, ultraviolet light has been shown to kill MRSA, which is one of the bacteria, and Clostridium difficile.
Infection reduction is carried over to the bed sheets and gowns, which are specially made to reduce skin ulcers caused by infection.
We partnered with an American-made company that makes the material that has been infused with an antimicrobial agent. So actually the sheets you lay on and the hospital gown that you wear actually fights infection.
Another fight that is a common occurrence is done by the smallest, most fragile members of our community who receive around-the-clock care as they fight to survive in the neo-intensive care unit. Ayoola tried for 11 years to get pregnant. After a few miscarriages, she finally conceived, but at 17 weeks along, she was ordered to bed rest in the hospital for 2 months. Then her daughter decided to come early.
My due date was actually December 12th, but she came almost 4 months early, and she came home on the 17th of December. So we're able to spend Christmas with her.
Women and Children's Services make up a large part of Cone Health Services. An expansion is on the horizon as plans are underway to break ground in the fall of 2017 for a new women's hospital.
I think women in the community feel a real affinity toward, so we're being very careful to do this right, but it will be relocated over to the Moses Cone Hospital campus. We think that will give us the opportunity, again, to improve the value that we provide to citizens in our region, both in terms of quality and in terms of cost effectiveness through creating some economies of scale by combining services on one campus.
These are just a few examples how Cone Health is raising the bar for cost-effective quality services, where its CEO says the level of care surpasses any other hospital.
The citizens in our region can know that they can access care through Cone Health and then know that they could not have gone anywhere else and gotten better care. And that's a great thing to be able to say for the people who live in this region, and we feel they deserve nothing less.